Welcome to Unit 9, Evacuation Planning Part 2. The unit objectives for this week is to explain the need for cities to prepare for carless and special needs evacuation planning, to explain the importance of multimodal transportation systems in evacuation planning, and to evaluate a community evacuation plan with respect to the 6 steps for all hazards emergency evacuation planning. In government in general, we have different professional silos, and this is certainly the case for evacuation planning. People who work in the transportation silo, and transportation agencies, it's just departments of transportation, transit agencies, other local government, Department of Public Works to deal with transportation, they often don't talk to people who work for emergency management agencies. And again, people that work for emergency management agencies and transportation agencies don't often talk to the people that work for the public health agencies. But all of these agencies and these silos and others are important for developing an important coordinated disaster emergency response evacuation plan and response, because when it comes to disasters, they don't care about silos. Disasters just rip apart communities, they cause destruction, and disasters also don't really care much about political boundaries. So if you work in a local government in Palm Beach County, for example, large disaster can impact not just Palm Beach County, but Broward County, Martin County, St. Lucie County, or it could impact multiple states like Florida, Georgia, South Carolina, North Carolina, Virginia. We need to think more broadly as we move into the future about how we can accomplish evacuation planning across political boundaries and across these silos of government that I mentioned just a little while ago. But first, why should transportation planners plan for disasters? We are having increasing numbers of severe disasters across the globe. And it's not just hurricanes. It includes, this is as a shot from Superstorm Sandy in New York on the top left. But we also have had events surrounding earthquakes and tsunamis, like in Japan, in Indonesia, and Haiti, and Chile, and New Zealand. We also have major flooding, and this is an example from Australia. And even in Iceland, we had volcanic activity that created major dust clouds that limited international travel over the this was a few years back, but it limited the amount of global travel. So transportation professionals, planners, policymakers, they need to think about disasters because there are a number of ways in which disasters can inhibit and destroy transportation systems. If you look at presidential disaster declarations over a 10-year period from January 2000 to January 2010, you can see that there have been disaster declarations all over the United States. There is no place in the United States, or in the world for that matter, that is immune from disasters. So we need to think about disasters from an all hazards sort of response. And while we may predominantly need to plan evacuations for major hurricanes in a place like Florida, we also should take the efforts that go into hurricane preparedness and apply those to evacuation for any types of disaster. There are nuclear facilities in South Florida that evacuation planning is very important for, and obviously people, the Nuclear Regulatory Commission mandates that evacuation plans are created for nuclear facilities. But there's other terrorism there's other natural disasters that could occur, or even industrial accidents, train derailments, or other sorts of disasters often prompt a lot of evacuations. And often when we look at evacuations, the easy thing to do is to look at a single mode of transportation, which is often automobiles, and a single jurisdiction, one particular local government. What gets more complicated is to think about multiple modes of transportation with multiple jurisdictions. These are large events, mass evacuation that necessitates the need to evacuate with all different types of transportation modes and a very large geography. So it's important to take a look at where multiple jurisdictions and multiple modes are being adequately planned for. In Europe, there were, this is an example of Chernobyl, which happened in the late 1980s, I believe. This map was produced in 1998, it looks like, or 2007, but Chernobyl, I thought the date was on here. But the point is that Chernobyl took place in Eastern Europe, and it had impacts on a literally global scale. When you look at it, it impacted two continents, Asia and Europe. From 1989 to 2009, there were 953 disasters that killed nearly 90,000 people in Europe, affected more than 29 million others, and caused a total of $269 billion in economic losses. Compared to the rest of the world, economic loss per capita is high in Europe because it's densely populated. So that comes from the United Nations. And if you look at the nuclear plants in operation in Europe as of January 2009, you can see these are all Chernobyls waiting to happen. They're all over the place, and they impact very large population centers. So we need to be able to think about disaster preparedness, evacuation planning, and how that happens. Now, during Hurricane Katrina, there were 1,800 deaths. 71% of the victims were older than 60. 47% were older than the age of 75. I worked on an article with a former student, Claire Cahalan, and we titled it Safeguarding Independent Living, Emergency Evacuation of the Elderly and Disabled. Elderly people want to live in their homes as long as possible, and they should live in their homes as long as possible. But when a disaster strikes or when there's an evacuation, we need to have a plan to get them out, because as we see in the aftermath of Katrina, nearly half of the people that died were over the age of 75, and that's just not acceptable. Evacuation accessibility is mandated under the Americans with Disabilities Act. Executive Order 13347 in 2004 required federal agencies to address the needs of the disabled in their emergency preparedness plans and assist state, local, and tribal governments in doing the same. Created the Interagency Coordinating Council on Emergency Preparedness and Individuals with Disabilities, and charged it with ensuring that the federal government appropriately supports safety and security for individuals with disabilities in situations involving disasters. Well, unfortunately, this Interagency Coordinating Council, while it was created in name and it, I think, did some stuff, hasn't really been the leader that it ought to have been. I mean, it was created 12 years ago, and they are still, I don't know if they even meet anymore, but there's not a lot of information about this group. So it was a good idea, but it has not yet really come to fruition. And the executive order still exists. and presumably could be re-looked at again and say, let's use this executive order as the modus operandi to move these ideas forward and ensure that evacuations are accessible to the populations that fall within protection under the Americans with Disabilities Act. People often don't realize that the largest regions in the United States have high shares of carless households. New York, Washington, D.C., Baltimore, Philadelphia, Boston, Chicago, San Francisco, New Orleans, Miami, Cleveland. They all have more than 25% of the population that does not have access to a car. And these are some of the largest cities in the country. So it's not acceptable for us to say that this isn't an issue. It is an issue for the largest cities, and we need to ensure that we have evacuation plans that work. There is a growing trend of elderly populations in the United States. In 2009, persons aged 65 and older accounted for nearly 40 million Americans, which represented about 13%. If you look at the year 2030, there will be over 72 million Americans over the age of 65, representing nearly 20% of the American population. So, as I noted earlier, the elderly were the ones that were the most impacted by the impacts of Katrina. And as our nation is growing in the elderly population over the age of 65, it is all that important that we put evacuation plans for carless, vulnerable populations together. And there's nothing wrong to say that elderly populations are more vulnerable than the younger populations, because most of them, or many elderly people, have health issues, mobility issues, transportation issues. So another area to look at is the percentage of owner-occupied versus rental-occupied housing units. So nationwide, we see that the percent of owner-occupied housing without cars is pretty low, but about 20% of rental units across the country, that's the far right bars on this chart here, 20% don't have a car. But if you start to look at some of the selected cities here, Washington, D.C., San Francisco, Miami, Chicago, New Orleans, we see that a lot of the populations of rental unit, people that live in rental units, have over 30, 40, 50%. In New York, it's almost 70% of the rental population that doesn't have access to cars. And what's good about the census is that we can map out these locations. We can look at the neighborhoods that have high rental households and high carless populations, and we can begin to put together specific evacuation plans for those carless individuals, carless households in those particular neighborhoods. What does the literature say? This is the article that you need to read for this week, and I'm just going to kind of highlight some of the themes of this article with regards to understanding what the literature says in carless and special needs evacuation planning. The themes that came out of this is accommodating special needs, literature looking at multimodal emergency response planning, special needs assessment, institutional issues, education, communications, and outreach needs, technology and planning and operations, and interaction across government agencies. Again, that's the silos. Talked about some of this already, but be sure to read this article so you can understand what the literature is saying for these key points. This is a report that I worked on. I was part of the panel that oversaw this project for the CDC, and they put together a guidebook and emergency preparedness web portal called Identifying Vulnerable Older Adults and Legal Options for Increasing Their Protection During All Hazards Emergencies. And you can go to this website. You can see the address down here. It gives all sorts of resources for how you can better prepare communities for evacuation planning and just responding for disasters in general, with a focus on the elderly populations. The Transportation Research Board has put together several reports that one of which you have been asked to read for this week, which is the one on the right, NCHRP Report 740, a Transportation Guide for All Hazards Emergency Evacuation. Another report that is worthwhile to take a look at is Communication with Vulnerable Populations, a Transportation Emergency Management Toolkit, and NCHRP, a guide, I believe it's 777 is the number of that one, a guide to regional transportation planning for disasters, emergencies, and significant events. I actually worked on the team that put together the 740 report and the one down below, a guide to regional transportation planning for disasters, emergencies, and significant events. And we're working on another one right now looking at resilient transportation systems. The project focus of the report 740, which is, again, the one on the right, Transportation Guide for All Hazards Emergency Evacuation, which you are assigned to read, was to develop procedures and tools to help transportation entities plan for a major evacuation event requiring coordination between multiple agencies, multiple modes, multiple jurisdictions, multiple levels of government, and private and nonprofit entities. In the first task of this project, we looked at the literature, and we looked at transportation and emergency management as being interdependent. We looked at establishing and maintaining communications and coordination among the agencies and the public, creating evacuation plans that concur with sheltering plans, and also have a plan for evacuee services such as fuel, repairs, water, preparing and training and practicing these evacuation plans ahead of time before a disaster strikes, adapting existing practices, systems, and resources, and planning for post-event re-entry back into the city after the evacuation. People need to get back home. The second task looked at the key findings involving the roles of the modes and other entities in evacuation planning. We looked at different transportation entities, including public transportation providers, private transportation providers, land, air, water modes, public agencies involved, including emergency management, health agencies, and private nonprofit entities, as well as what are some of the lessons involve early. The various agencies need to be involved early, often, and establish agreements ahead of time, because a lot of this stuff gets into legal contracts between one agency versus another agency, or between public agency versus a non-profit organization. The roles in all the planning phases could vary from notice evacuations to no notice evacuations, but should consider the 4 areas of prevention and protection, mitigation, response, and recovery. The third task of this project looked at recommended mode integration steps, identifying entities, their roles and responsibilities, with regards to multimodal and multi-jurisdictional evacuation. Identify one or more convener agencies for multimodal evacuation. We labeled this as a convener agency for multimodal evacuation, CAME. That's an acronym that came out of this project. So what this says is that there should be an agency that takes the leadership and convene all the other ones to meet. And it could, in different regions, it could be different agencies. It could be a transit agency. It could be a metropolitan planning organization. It could even be a very large local government like Miami-Dade County or Palm Beach County could convene all the local municipalities within that county. And then they need to determine a framework. Is it local, regional, or state? And we like to say, it should be all of the above, but likely for the way in which evacuations occur, thinking about the region is important because that's where you're going to have most of your traffic congestion is in regions. And do you have an emergency management agency or a transportation agency take the lead? Or can they share those responsibilities, which is another possibility? Then the fourth task was to look at matching resources with needs. The focus was on local governments primarily, and to identify and inventory resources, including partner agencies or public-private sectors. They need to collaborate together. We did interviews with departments of transportation, transit agencies, emergency management agencies, metropolitan planning organizations. We looked at each of the major entities and the modes identified in the role in providing transportation resources and the role in identifying community needs and issues to consider. So this is kind of the template that we created in looking at matching resources with needs. On the left side, so the column on the left which defines the rows, you can see the entities and the modes. So there's management entities, there's personnel, equipment. These are the resources, vehicles, data, partnerships, agreements. And then we recommended that each region, each convener agency of multimodal evacuation describe the resource, look at matching the needs from those resources to where the needs are, and then developing some actions to ensure that the resources are adequately applied to the emergency evacuations planning process. Then what we did was what we called a workshop in a box. This is something that we created as a part of this project that agencies can take and implement themselves within their own regions. Basically, plan a workshop which assess the current status of evacuation plans, develop preliminary goals and desired outcomes, build support and collect input for the plans, design a workshop to bring everyone together, develop the meeting materials, and we have a lot of resources that they can use for that in this project. Secure facility and the plan logistics for the meeting and recruit participants. Then you implement the workshop. You ensure that you check your facility, your supplies, you plan your assignments. Your facilitator should follow certain protocols for bringing all these diverse stakeholders together. And then the follow-up, you document the meeting and you share it with the participants. You maintain that momentum of bringing all these people together. You strengthen the working relationship and you use that feedback to improve local and regional and state evacuation plans. We conducted some case studies. We looked at 2006 North Carolina chemical fire and 2007 South Carolina wildfires, chemical spill in Louisiana in 2008 Hurricane Gustav, and we looked at some of the key findings from that. Also some other case studies in Hurricane Ike in 2008, Philadelphia snowstorm in 2010, Tennessee floods in 2010, and though lessons from those case studies helped us better understand how to create an evacuation plan that works to all these different types of hazards. Task 7 looked at operations plan templates. We selected templates for evacuation planning, and we tested the ideas of the workshops we developed and refined based on the Task 5 workshop, and then we developed a draft guidebook. The draft guidebook included these chapters, and then we then finalized that into steps. And the steps here is, as you'll see in the report when you read it, is to, 1, form a collaborative planning team. And that team should identify the core planning teams and engage in whole community in planning process. Understand the situation, identify the major threats and hazards. You document that through meetings. You engage the whole community again in that process. Determine your goals and objectives. What are the operational priorities? Again, this could be done through a meeting that sets goals and objectives. Then you develop your plan. You develop and analyze your course of action. You can do that again through a meeting. You identify your resources. Again, another meeting, and you identify the information and intelligence needs. Then in step 5, you develop your plan, preparation, and you review it, and then you approve it. So this is where you actually write the plan, you review the plan, you re-review the plan, you then approve and disseminate the plan to the region and all of the various agencies, nonprofit organizations, private sector partners, and the public as well. And then in step 6 is when you implement and you maintain the plan. So you exercise the plan if needed, and then you review and you revise the plan accordingly. So to get in depth just a little bit more, some of the tools with regards to Chapter 1, forming a collaborative planning team, looks at developing a network contact database, and then potential frameworks for integrating modes and entities for effective evacuation. Again, that's the convener agencies for multimodal evacuation. Introduction to emergency support functions and transportation roles and interactions with each ESF. It's very important. That's the formal process by which governments respond to disasters underneath the FEMA, Department of Homeland Security, National Response Framework, and then potential community partners. Chapter 2, tools, and look at understanding the situation, preliminary risk assessment, database templates, estimated number of evacuees, institutional facilities, non-institutional assisted evacuees, looking at animals and livestock, and evacuation needs discussion guide. Chapter 3, tools, looks at a discussion guide, transportation coordination spectrum, considerations for access and functional needs populations, primary entities and modes involved in evacuation, and transportation operations coordination checklists. This is an example of a tool, 3.2, that looks at the level, independent, look at travel and transfer without help, self-selected, private sheltering, and the types of modes. People could take mass transit, buses, trains, or personal autos. And then you have minor assisted, not related to mobility issues, people who might be deaf or hearing impaired or blind or with cognitive disabilities, and they could be sheltered in different scenarios, including private sheltering or perhaps public sheltering with assistance from general shelters, possibly including companions or caregivers on case-by-case basis. And they could take public transit, personal automobiles, vans, for example, from group homes or adult daycare facilities. Then we go to minor mobility assistance and adaptive transport, and then travel with assistance, and then major mobility assistance, major medical assistance. So this is kind of a spectrum from independent evacuation all the way up to major medical assistance, and it looks at the types of access and functional needs for each, the sheltering needs, and the transportation modes and or vehicles needed for that. So this gives planners and emergency managers a better framework. Even though very much of this is all intuitive common sense, it's really nice to have it laid out here in a table so people can really make sure that their plans take into consideration all these different types of folks. Chapter 4 tools look at plan development, discussion guide, establishing a timeline, identifying resources, identifying intelligence and information needs, and then, of course, certain resources and checklists of information underneath each of these categories. And then establish a timeline. This timeline that we see here was adapted from the City Assisted Evacuation Plan in New Orleans that was developed after Hurricane Katrina and implemented during Hurricane Gustav. There's a leaning forward phase of the timeline, which is basically this is a reverse timeline. It goes backwards into the number of hours before hurricane force winds or maybe even tropical storm forced winds will hit the impacted area. So here we see 84 hours to 60 hours is the lean forward phase of the public assisted evacuation plan timeline. Under the lean forward phase, local, state, federal agencies and they begin to activate their plans. They start to notify their staff. They begin to mobilize their resources and their equipment. Then the next stage is to launch the public assisted evacuation plan, dispatch buses and security. That's at 60 hours before the storm. And within a few hours of that, they begin evacuating people to the airports, or people who need to leave the region via plane begin to, around 54 hours before the storm, they begin picking up people for the ground-based portion of the public assisted evacuation plan, including bus, rail, vans, and ambulances. And then they continue to execute that plan until 30 hours before the storm is when it begins to wind down. Now, when the public assisted evacuation plan begins to wind down, that is when the contraflow begins of the highways, and that's when a lot of the people who are going to drive out of a storm get in their cars, and both sides of the highway will face outwards away from the impacted area. And we saw examples of this during Hurricane Matthew in North and South Carolina, where they did use contraflow there. And then, 12 hours before the storm, that's when the airports shut down, and that's when the last vans and trains and ambulances will leave the area. And that's when emergency responders begin to mobilize for the recovery phase. And then, of course, in those last 12 hours, there's always last minute people that might call or need help, and that's, of course, when the firefighters and police officers and in some cases National Guard are going to ensure that those people are out of harm's way. But at that point, it's the masses of the people should have hopefully left. Now, of course, this is for a hurricane evacuation because in no notice disasters, you don't have these 84 hours to prepare for the disaster or the hurricane to impact the area. So there's elements of this that could be utilized in a no notice disaster. For example, you can still go through all the steps. You just don't necessarily have the time, and you're more in response once a disaster strikes. But if you have all the plans in place, you can certainly take advantage of the resources. You can notify staff. You can implement contraflow. You can do a lot of these things under the no notice scenarios. But again, this outline is really lined up for the hurricane evacuation. In step 5, we look at plan, preparation, review, and approval. There's the multi-jurisdictional, multimodal evacuation coordination template outline. There's the multi-jurisdictional, multimodal evacuation planning checklists. There's a sample MOU, that's a memorandum of understanding with transit agency as a convener, and there's a sample agreement with the Metropolitan Planning Organization as the convener agency. So all of this stuff is really laid out there in this document. And chapter 6, tools of plan implementation and maintenance. There's after action reporting, real events, FEMA guidance. There's after action corrective action report survey template. There's the overview, description of drills, simulations, and exercises. There's a participant feedback form. There's a facilitator report form, and there's a summary for the full after action report template. So that, in a nutshell, describes that document. The document is meant to be used to help guide local and regional agencies to actually do this, and that's why there's all these examples of tools and templates and checklists and MOUs. What I want to just wrap up this lecture is a brief discussion of some research I've been doing, looking at emergency transportation planning in the United Kingdom, comparing it to the United States as an example. And in the United Kingdom, the Cabinet Office is responsible for putting together emergency response recovery policy. They're called the Civil Contingencies Secretariat, and in 2004 they put together this document on emergency response and recovery called Non-Statutory Guidance Accompanying the Civil Contingencies Act of 2004. If you look at the UK website, they have good information about improving the UK's ability to absorb, respond to, and recover for emergencies. And I went up and met with the folks at what's called the Emergency Planning College. Now, this is not a university. This is actually a part of the Civil Contingency Secretariat, which is the equivalent of the Department of Homeland Security in the UK. And the Emergency Planning College, their mission is to go and train people that work for government, people that work for the private sector, to make the UK more prepared for evacuation planning and crisis and resilience. And they have a lot of good policies on evacuation and sheltering. And London, what's called the Greater London Authority, which is a regional government that's much like the equivalent of the Palm Beach County or Broward County or Miami-Dade County, but their jurisdiction literally encompasses the entire region of London. So they really have the ability to coordinate. And if you look at their website, they have information about all sorts of stuff like arts and culture and health and regeneration of local areas and housing and land transportation, environment planning. And when you look at when you look at their information, they do have some good information, but they have similar problems that we have in this country, in that there are the lack of information about what to do to evacuate for a disaster. And you may say, well, London doesn't get hit with hurricanes, and why would they need to evacuate? Again, they still have a lot of potential disasters there. Certainly terrorism is a big concern there, but they also are very susceptible for flooding. Sea level rise is certainly going to impact the London area. In fact, they have these flood control big diversion dikes, not dikes, but they call them floodgates up the Thames River. And if those floodgates, for some reason, were to fail, there could be literally millions of people that could potentially be susceptible to flooding, in which case you would need to have an evacuation issued. And they get these harsh winter storms, and they get the king tides there, just like any coastal area gets, and those sorts of events could lead to significant flooding. So there are some really good policies at the national level with the Civil Contingency Secretariat, but what I learned in my research is that they haven't really done a great job in implementing the local plans to educate the communities and the people about what to do if they should need to evacuate. So that is the end of Unit 9. Thank you very much. The next unit will be Unit 10, Community Planning and Preparedness. Thank you.